Hello, today I am going to be demonstrating a male insertion of catheter for demo purposes. So, good morning. Hi, my name is Caitlin. I am a student nurse at NTC and I am going to be putting in your catheter today. Could I have you verify your name and date of birth, please? Great. And could you verify for me, John, if you have any allergies? Great. All right, I'm going to be just over there getting your things ready for you, and then I will insert your catheter. All right, so I'm going to be looking at my MAR. John Williams, date of birth is correct, allergies. And then we want to make sure that we are giving this at the right time, making sure we are giving or inserting a catheter. So it's the right patient, dose, time, route. Great. All right, and you can see when I entered the door, I did sanitize my hand. I provided for privacy. And then, so this will be my sterile field. I will move it because I don't have much room to be working with. But my patient's penis will represent the water bottle. Okay. All right, John. So I am back. I have my set right here and I will be getting started. So obviously this will be shut. I want to make sure I pull away. And I'm never reaching over my sterile field. And I have my 2 inches to work with. Great. My hands are sanitized, and today we're going to proceed in acting like the patient just got pericare done. All right, so I have my sterile gloves. I will put those on. First, I'm going to pinch. Great. And then I want to grab under the cuff like this, hitchhike my thumb like this, reach in, great, and then since I have my sterile glove I can fix my finger here. Great, so I can just set this over the side, making sure I'm not touching anything. Alright, so now I'm just gonna make sure I have everything I need. And I am going to lubricate the end of my catheter before even moving to the bed. Okay. Great, so that is just sitting in there. And my tray, good. I'm gonna go ahead and connect my syringe right away. And I'm going to bring everything to my working space so that way I don't feel like I need to move back and forth. But first, we're going to insert this pad underneath the client. And I want to make sure that I kind of have it tucked so I don't break the sterile field. So we're going to go ahead and push this under the patient. Great. Okay, and then I will put this over the penis. Making sure I'm not touching anything. Great. So then I am going to go ahead, I'm just moving this so you guys can see here. I'm going to move my box over to my working area here. And then with my non-dominant hand, I'm going to go ahead and clean the area. So I'm going to pull that foreskin back, making sure I'm cleaning correctly. And I do have my garbage right here. And I do want to make sure that I am swiping down near the anus. And I'm not touching, I'm not breaking sterility with my sterile gloved hand because I do have to insert the catheter tubing yet. So making sure that everything is cleaned up before inserting again. There was pericare done already. Great. So now I'm going to take my tubing outside of the lubrication, making sure I'm not touching it with my non-dominant hand because that already has been contaminated. Alright, so now I have my tubing. I'm going to go ahead and grab the tip of the penis and insert. I'm just scrunching, I don't know if you can see. There. Okay, go about 6 to 7 inches. And then I do see here there is some urine, which is a good sign. I can go another 2 to 3 inches. Great. So now that has been inserted, and I will inflate my balloon. Great. Alright, so now I can just put that with my trash. And then, with my sterile hand yet, I am going to go ahead and give it a tug and make sure it stays inside the penis. And it looks like we are good. Make sure that my bag is rolled out nice. Alright. And then I'm going to go ahead and hang this on the side of the bed, making sure I'm not connected to anything that would decrease the flow of the urine, making sure there's no tube kinks. Great. And go ahead and connect that to my bed. Alright, so now that I am done with that, I can go ahead and remove my blue sheet. And then I could just tear this off, but for today's sake, for practice purposes, I will just go ahead and remove it after the video. So then I'm going to go ahead and clean up all of my garbage. Make sure that my patient is comfortable. And make sure they don't need anything before I leave. Make sure they have their call light. Alright, John, and I'm going to make sure I sanitize my hands again. Here is your call light, and is there anything else I can get for you? Okay, great. Please let me know if you need anything. And then I do want to make sure that not too much urine is being poured out because that could cause spasms. And in that case, if it was, I'd want to kink off the tubing just so that it would prevent the bladder spasms. Okay, so now my patient has everything they need. They're all right. They have their call light. They don't need anything. So then I'm going to go back and document what I all did. So I inserted the catheter to John Williams. Date of birth is correct. There's no allergies. No complications, anything like that. Alright, and then everything is cleaned up and my patient is doing well. And that concludes my demonstration of inserting catheter. Thank you.